The Organisation of Islamic Cooperation has urged African countries to identify and preserve the knowledge of traditional medicine and employ it in cancer treatment. The Assistant Secretary General for Economic Affairs, Science and Technology, Dr. Ahmed Sengendo, said this in Abuja at the high-level regional seminar on promoting cancer awareness and advocacy programs in OIC member states. The third edition of the OIC High-Level Regional Seminar has the theme Innovative Approaches to Cancer and Early Detection. It was hosted by the First Lady, Senator Oluremi Tinubu.
It is high time we started taking cancer seriously, just as we consider other killer diseases such as AIDS, malaria, and tuberculosis. Our fast-changing lifestyles, rapid urbanization, unhealthy diets, lack of physical activities, and environmental exposures have made all of us susceptible to cancer. Elevating public awareness about cancer, particularly the critical importance of early detection, stands as our primary weapon in this fight. Astonishingly, 1/3 of all the cancer cases is preventable, and 40% of all cancer-related deaths could be forestalled through early detection. More than half of the OIC member states are low and medium-income countries. The burden caused by cancer calls for dedicated resources, both financial, human resources, and infrastructure that is available from the national health budget. In this light, we commend the civil society organizations gathered here from various member states for coming out to complement government efforts in fighting cancer.
The World Health Organization country representative, Dr. Walter Mulombo, said that it is high time Africa started taking cancer seriously, as well as other killer diseases such as AIDS, malaria, and tuberculosis.
Cancer is not just an adult disease, as we realize. Children are also afflicted, with about 400,000 children developing childhood cancer globally every year. And in 2022 alone, approximately 50,000 new cases were reported in this region. And most of these childhood cancers in the region are leukemia, non-Hodgkin lymphoma, and kidney cancer. So in general, cancer survival in the region are abysmal and are driven by late detection and limited availability of screening services. But I would like to emphasize also that despite the dire cancer situation in our region, progress has been made, with 17 countries having introduced performance-based screening tests in line with WHO recommendations, and Nigeria is one of them.
The Director General, International Atomic Energy Agency, Rafael Grossi, said that cancer could be prevented or even treated with the right tools.
Where I work in Vienna, almost no woman, almost, statistically speaking, dies of breast cancer. In Africa, this may be a death certificate. And this is something that it is within our reach. We have the technology, we have the capacity to do this, we have the capacity to change this. We are not in front of an unsolvable problem or something that may require billions and trillions of hard currency to be solved. Sometimes it's about having a radiotherapy unit in a small town, or having the capacity to have access to radiopharmaceuticals, to radioisotopes, so that we can cure people. The IEA is not about policy. The IEA is about concrete projects. It's about giving you the technology. It's about training your doctors, your oncologists, your radiotherapists, so that they are able to provide these services to your people.
For his part, the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, said that the seminar aims to promote cancer awareness, advocacy, access to and the affordability of cancer treatment.
Today is a very remarkable day in our fight against cancer in Nigeria and the entire Africa. We are delighted because the President of the Federal Republic of Nigeria, His Excellency President Bola Ahmed Tinubu, has taken the driver's seat in the fight against cancer and other killer diseases in Nigeria. We're also pleased with the uncommon commitment of the wife of our President, our First Lady, Her Excellency, distinguished Senator Oluremi Tinubu, who has assumed the role of a co-pilot in the fight against cancer alongside with our President. Permit me to place on record that within the first year of the administration of President Bola Ahmed Tinubu, the health sector has received more attention than it has ever received in the last 2 decades. Mr. President's commitment stems from his renewed hope agenda, which has witnessed unprecedented success in various sectors of the economy, including the health sector.
Highlight of the event was the Abuja Cancer Declaration of the First Ladies of OIC African member states on promoting cancer awareness and advocacy programs. Present at the event were the First Lady of Turkey, Mrs. Emin Erdogan, the First Lady of Sierra Leone, and other foreign delegates.